Welcome to the Real GI Doc Show. I'm your host, Dr. Fred Gandolfo, and I'm a board-certified gastroenterologist with a medical practice in New York. Today's episode will be a Q&A. I'll take a listener question and try to answer it to the best of my abilities. Please, if you have any questions of your own, it's great to submit them to me at realgidoc.com. There's a link to submit an audio question there. And you can also find me on social media and leave a question in a comment somewhere, and I'll see it at some point and add it to the list of questions. And today, if you're just joining us, this is my first podcast that I'm recording from a little studio room that I found. It's a little echoey. It's still a work in progress, but I'm behind on recording, so I figured we'll do an episode here. And there's a boiler running somewhere that I can't figure out how to turn off, so you may hear some noise in the background somewhere. But it's all good. We're going to get this episode out, and I'll work on the technical details next time. We'll try to figure out what's up with this echoey space I'm in. So today's question comes from a listener named David in San Diego, California. David says, "Dear Dr. Gandolfo, I watched your videos on YouTube and they are very helpful. However, I am just not able to keep the prep fluid down. I have a very severe anxiety issue in general, and nausea and vomiting related to that. The more my doctors say, I just need to do it, or I just need to relax, the more stressful and difficult it becomes. I have failed 4 times now. My question is whether there is such thing as an IV option for prep fluids. Does this option exist? How would it be done? I asked my doctor, and he's never heard of such a thing. His only advice is to stop being anxious and just not throw up, which, if you knew me and my anxiety, would be just as unreasonable as telling a person with colon cancer to just not have colon cancer. I know from experience that I'd be able to tolerate IV if the option existed. I also tried the tablets, but I have trouble with pills that are not small and just could not swallow a single one. I really want to get a colonoscopy, especially since my grandfather died of colon cancer. Signed, David." All right. Well, let me start with the little disclaimer that this is not medical advice, and what I'm going to discuss is just general information about colonoscopy prep. So to answer David's question, I'd like to take a couple of steps back. First, we're going to start with a quote. This quote comes from the Roman emperor and Stoic philosopher Marcus Aurelius. "Today, I escaped anxiety. Or no, I discarded it because it was within me in my own perceptions, not outside." So to answer the question, no. The answer is no. IV prep does not exist. There's currently no intravenous medication that we can give to clean out someone's bowels adequately for a colonoscopy. In general, prep has to be taken by mouth to clean out the colon because the mouth leads down to the colon. And if we're going to drink stuff or take pills, they have to make their way into the gut, and that is through the mouth. Now, to take a few steps back even further, why do we even do colonoscopy in the first place? If you're just joining us and you haven't listened to lots of colonoscopy talks, well, colonoscopy is the best test to prevent getting colon cancer. So colon cancer is very common, unfortunately, and it starts off as a small growth called a polyp. Polyps are little precancerous tissue growths inside the colon, and they're present very commonly in people over the age of 45. Here in my practice, I find polyps in about 45 to 50% of people. These are precancerous polyps coming in for their first colonoscopy, and that's a lot of people. So if you pass 10 people on the street today and they're all over the age of 45, half those people are going to have polyps. That's like a lot of polyps walking around the streets. Today, I'm just coming off of a long day. I'm actually recording this in the evening. This is my first evening time podcast. So I'm a little tired, I'm a little spent. We did a bunch of colonoscopies today. We got a bunch more tomorrow. And we sent off a whole bag of polyps to the lab. We take the polyps out on a colonoscopy. We send them off to the lab. We see what they are. But most of them are precancerous polyps. And if you take them out, then you don't get colon cancer. And if you leave them in and you wait long enough time and you're the right person to get colon cancer, if you're a little unlucky, then a polyp will turn into cancer over time. And cancer, once it is present, is a lot harder to treat than just removing a polyp in a colonoscopy, which is about a 20 to 30 minute procedure, done with minor sedation, minimal discomfort, and minimal risk. So much better to be proactive in general and take out polyps than to wait for them to turn into cancer and cause a problem. Colonoscopy requires a preparation of the colon. You have to do something to clean out the colon. Otherwise, we're going to stick the camera in there and see a bunch of stool, and that's not very helpful. So we do a bowel purgative or a bowel prep. Usually that involves drinking a whole bunch of liquid. Recently, there's been some new prep that's out. That's a pill-based prep called Sutab. And David was alluding to some videos that I have on YouTube that I can link in the show notes about Sutab and Suprep and some other preps that you can do. But basically, they all involve taking stuff by mouth, either pills or a prep solution and a whole bunch of water. And what usually happens is soon after taking the prep, you poop your brains out, and then you do it again and again and again until you're totally clean. And then the next morning you come in for the colonoscopy and we put you to sleep for a few minutes with some anesthesia, and you wake up and it's all over. And I can tell you if you had polyps or not. That's the gist of a colonoscopy. So what I hear from David's question is that there is an intolerance of any type of oral prep, including even pills. And basically that's unfortunately an anxiety-related issue. David even calls himself out and says it's his anxiety that causes him to not be able to tolerate prep without vomiting. So that's why he can't do the traditional prep. So what about alternatives? So there's a few alternative preps out there. There's Miralax prep, but that still involves drinking a bunch of liquid. And the only other prep that I can think of that does not involve drinking anything that's unpleasant, and this is not like an FDA-approved prep. This is just something that I've heard of or used maybe a few times in my career, and it's definitely not a real way to prep the colon. I would not advise it to people, but if I really had to pick a way to get David through a colonoscopy, this is not really medical advice to David. It's just something to think about. You can ask your physician about this. Sometimes you use Dulcolax as a prep, and Dulcolax is a stimulant laxative. It's a very tiny pill, really, really, really small. You can lose the pills if you misplace them. They're that small. And basically you buy a bunch of Dulcolax pills and you go on a clear liquid diet. So that's juice, water, Jello, broth, Italian ices, iced tea, black coffee, black tea, Gatorade, that kind of thing. You go on a clear liquid diet for about 2 days, or actually for 2 days. And prior to that, you even cut out some roughage. You cut out seeds, nuts, anything that's going to stick behind and leave a residue in the colon. So cut all that stuff out for a few days prior. Then you go on a clear liquid diet for 2 days prior to your colonoscopy. And then you take 10 milligrams or 2 Dulcolax pills twice a day for those 2 days. So for example, if your colonoscopy is on a Friday, that means that like the previous weekend, you start cutting out seeds and roughage. So you're not going to be eating a bunch of vegetables with skins on them. You're not going to eat chia seeds. You're not going to eat popcorn, nuts, any of that stuff. Cut all that stuff out completely because that sticks around in the colon forever. Makes it very hard to see what's going on, especially when you're doing one of these preps that's not really a adequate FDA approved full bowel prep. So you want to hedge your bets and really do the low fiber, low residue, no seed, no nut diet for several days prior. So you cut that stuff out the weekend before. Then the 48 hours prior to the procedure, so that is Wednesday and Thursday, you would start a clear liquid diet. So all day Wednesday, all day Thursday, you just drink clear liquids. And Wednesday morning, you take 10 milligrams of Dulcolax. And Wednesday evening, you take another 10 milligrams of Dulcolax, and you repeat that exact same thing on Thursday. So another 10 and another 10. So a total of 40 milligrams of Dulcolax over those 2 days. Now that's a lot of Dulcolax. Again, this is not really a recommended thing to do unless you really have no other way to get prepped for a colonoscopy. Dulcolax taken to large amounts can cause issues with bowel ischemia, potentially. You can get cramps, severe pain, sometimes bleeding. Usually not really dangerous, but definitely is not the way to go for the average person. Also, you want to make sure that you're staying very hydrated throughout this process, drinking lots of liquids that have electrolytes in them, sports drinks, broth, something with salt and sugar in it. This kind of bowel preparation could definitely cause someone to become dehydrated, but if it's all you can do, then sometimes the end justifies the means. Now, you do all that. Dulcolax causes cramps and causes you to go to the bathroom quite a bit. Keep drinking clear liquids, keep taking the Dulcolax. 2 days of that, typically you're clean enough for a colonoscopy as long as your bowel habits are pretty normal and you're not backed up at baseline, because that makes it really hard to clean out. Now, I thought of something that I've heard about before. I've never actually seen it in real life. There used to be this thing called high GI prep or something like that. HYGI prep. High G prep. I think that's what you say. High G prep. This thing was some type of giant enema device that it's like a thing you sit on. It looks, I don't even know what to even describe it as. It's some big contraption, and they basically do a enema for an hour. They put a tube up your butt, and infuse a bunch of liquid in there, 40 liters of liquid. Hopefully it's warmed or, to some temperature that's comfortable. But they infuse the stuff in there and they let it percolate through your colon for an hour. And basically you clean out with just this massive amount of enema liquid. Sounds horrible. It was studied by the manufacturer. So they basically paid for the study and they said it's great. Of course, that's what's going to be the outcome of a manufacturer-based study on a device like this. And it looks like the company, I can't find them. They went out of business, it looks like, as of November 2022. Their website's gone, and the founding guy who invented it seems like he's on to bigger and better things, or whatever you want to say about that. So who knows? That maybe some people do have this device somewhere around, but it seems like, I don't know if I'd advise that either. It sounds a little ridiculous. My advice for David is to do a Cologuard test. Even despite the family history, because this isn't a grandparent, it sounds like, do a Cologuard test. Do something now. It's easy. It's hopefully going to be negative. You have a little bit of time to wrap your head around this whole colonoscopy thing. Cologuard is not anywhere near as good as colonoscopy in terms of screening and prevention of colon cancer, but it's definitely better than doing nothing and just worrying about not being able to get a colonoscopy. So that's what I would do. I would go get a Cologuard now. Hopefully that thing comes back negative. You have a couple of years to think about it. Doesn't mean you can't have a polyp, doesn't mean you can't have cancer. Cologuard is far from perfect, but I would advise doing that now. I would also advise doing some making sure that you're doing healthy living strategies to prevent colon cancer. We've covered this in the past on episodes on this show. It's a topic I cover routinely, but really that just means eating a high fiber diet, lots of fruits, veggies, whole grains, watching out for too much red meat, processed meat, that's like sausage and bacon type cured red meats, not eating too much processed junk food, making sure you're watching your weight. Obesity is a big source of people getting chronic inflammation, which leads to colon cancer. Avoiding drinking alcohol to excess or drinking it at all, because that's a major modifiable risk for colon cancer and colon polyps, and not smoking. So if you're keeping your weight in check, avoiding alcohol, avoiding smoking, keeping the diet high in fiber, limited in meat, like a Mediterranean style diet, which we've covered before, and you're exercising and all that stuff, then you're trying to reduce your colon cancer risk naturally. And you do a Cologuard test and you're fine for now. That will kind of cover you for screening. In the meantime, what you can do when you're doing all these things is you can start to focus on the anxiety as the issue, because for a grown adult to not be able to drink PrEP and not be able to take pills, that's kind of a problem. That kind of anxiety is kind of like life-changing anxiety. I'm sure this is not the only thing in your life that's affected by anxiety. I'm sure it's causing many different problems in your life. And maybe you're seeing a psychiatrist already and you're getting therapy and you're doing meds and all that stuff, but that's really the thing to focus on is the anxiety. If you're not doing that already, it's not just it's my anxiety type issue. This sounds like it's really like crippling, mental anguish type anxiety. And I think the PrEP issue is just one minor thing to focus on. I think getting therapy, making sure you're seeing a professional, a psychiatrist, maybe for medication, and a therapist, some type of psychologist to help with this anxiety is the way to go. And eventually, hopefully, with good treatment, you'll be able to tolerate some PrEP without these issues. In general, life is hard, and bowel PrEP is not really that difficult when it comes to all the things that life can throw at a person. There's like a global scale of life hardships. So, bowel PrEP is really like a 1 compared to, like being involved in trench warfare or something like that. You never know what's going to come up in life, right? Some serious stuff might happen. And if you can't handle bowel PrEP, then are you going to be able to handle someone getting sick? Are you going to be able to handle yourself getting sick and needing intensive chemo or surgery? Or maybe you find that you do have a colon problem and you need colonoscopies every 6 months or something like that to take care of some type of giant polyp. Like there's things that can come up medically for you. Family can get sick. You might need to donate an organ to somebody. There's all kinds of stuff on the hardship scale that are much scarier than bowel PrEP. So it's a good idea to start to tackle this anxiety. And I don't know how old David is, but it's a good idea to start to tackle this anxiety now, because things can only kind of get worse as life goes on in terms of stuff you have to do that's not fun or pleasant. It's better to start working on it now. And eventually, hopefully, just like our friend Marcus Aurelius that I mentioned earlier, you can learn to discard your anxiety and realize that you don't have to be defined by it. And you can finally get that colonoscopy that you've been dreaming of. All right. Hopefully everyone enjoyed this episode. I'll be back with some new stuff soon. I'm still working on this space. It sounds like an echo chamber right now. Hopefully the sound of this episode sounds decent. And I'm adding some video. I'm still trying to figure that situation out as a one-man show. This is done on nights and weekends. So stay tuned, hopefully, for some good stuff coming up. I have a whole bunch of good questions to answer that have been asked by listeners or readers or viewers or however you find this information. So keep asking the questions and I'll keep adding to that list, and I eventually will tackle your question. So feel free to ask it, and it ends up in the hopper and I pick some cool stuff to talk about. I have a whole bunch of stuff coming up soon, hopefully, on probiotics and GLP-1 agonists like these weight loss drugs, Ozempic and Mounjaro and others. A whole bunch of stuff on that, some other stuff on cancer, and some questions about gastritis, and some questions about reflux, and all kinds of other cool stuff, including gas. Lots of gas questions and poop questions. So I'll make a mix of things, and we'll just basically cover them as they come up, as I have time to cover these Q&As. I like the Q&As. They're fun. All right. You can find the show on social media at RealGIDoc. You can find the site, realgidoc.com. You can leave me a message or a question. And if you can rate the show on Apple Podcasts, that would be great, because we need a few more ratings and definitely some comments. When people search around on Apple, they can't find me. It's very, very sad. Or maybe it's better for the world. Who knows? But if you leave me a rating or a review there, that is the way to keep these episodes coming.
That's it for this episode of The Real GI Doc Show. Make sure to join Dr. Gandolfo next time to explore another interesting topic in gastrointestinal health. And remember, the views and opinions presented in today's episode are for informational and entertainment purposes only. Nothing discussed in this episode should be considered or used as a substitute for medical advice, diagnosis, or treatment. If you're experiencing a health issue, please consult with a doctor or a medical provider in your area. Thanks again for listening to the show.